Hello again, everybody. Day 23 post left ulnar nerve transposition. Everything's going pretty well, I would say. I'll show my range of motion in the scar this time. I don't have to wear that god-awful splint at all times anymore. Basically just in risk-averse situations. So when I'm in a car, I wear it, and when I'm sleeping, I wear it. Other than that, I don't really wear it at all, which is nice because that thing was terrible. But this is what the scar looks like right now. Not too bad. Healing up pretty well. These steri strips just don't fall off on their own at all. But it's really scabbing over, almost completely closed. I still have quite a bit of bruising, as you can see, up there and down to here. It's actually clearing up around the scar first, which is weird. And then the triceps are also a bit bruised. And I'd say the triceps are where most of the tightness really is. Here's the range of motion I got. Can extend basically all the way, can almost lock it out, and then I can bend it essentially up to my shoulder. If I point my thumb, I can basically touch my shoulder. Yeah, I got really good range of motion. There's quite a bit of tricep tightness, that's the main thing. And I can feel the nerve kind of going back and forth occasionally, like right here, which is where it is. When I flick, I can feel it kind of shoot a little, not a zap, not a zinger, but I can just kind of feel the nerve when I flick right there. And then I'd stuck my finger in the cubital tunnel the other day, and it's wild. There's nothing there, which is, I guess, the goal of an ulnar nerve transposition. But yeah, I'd say everything's feeling pretty good in terms of the nerve. My right arm feels horrendous, but I signed up for that, I know. I'm gonna do my right arm in approximately 3.5 weeks, around December 10th-ish. Can't wait. That's gonna be an exciting day. Can't wait to not have it in my right arm. I don't really have nerve pain anymore, I wouldn't say. It's really just like around this area right here. It's not entirely numb, but it's like from here to right here on the actual bone. It's just like, I guess numb is the word to use, but it's not entirely numb. And then kind of under here, it just feels a bit weird. I don't get pins and needles anymore. I don't really get too many zingers. The only time I get zingers is really when I'm sleeping or when I'm like sitting. Because like the only way to comfortably sit is kind of with your arm like this, like kind of leaning a little bit against the nerve and the scar. And the only time I really get zingers is when I'm doing that. And when I'm sleeping especially, because I sleep on my right side with this on a pillow. And sometimes I'll get some zingers that shoot while I'm leaning on it. And I gotta wear that brace when I sleep. I have OT in about 2 hours today. And I'm looking forward to that massage. But every day I massage the muscles and the triceps, all these muscles around here for 10 minutes twice a day, and then I massage the scar, just kind of go in little circles very lightly for about 5 to 10 minutes twice a day. And then I also have been using a heating pack once a day for about 15 minutes, and then I shower as well, which it's kind of the same thing, but a little different. And shower for however long I shower for. But yeah, I'd say everything's going pretty well. I have like basically not full wrist range of motion. In this regard, it's still a bit tight, and in this regard, it's still a bit tight. And then same with the wrist circles, it's a bit tight as well. But other than that, I'm feeling pretty good in terms of the nerve. There's something wrong with both of my wrists, which is yet to be determined, but those will be figured out eventually as well. Although none of you are watching that for this, so I won't even go into that. But in terms of the nerves, I'm actually feeling the left nerve, it's feeling pretty good. No tingling really ever. I mean, the fingers get super cold when I go outside, so I usually will put a hat over this, or put it in a pocket. I gotta wear these stockinettes for the swelling, although in my opinion, most of the swelling has gone away. There's just like residual swelling at this point, and it's really just the bruising that is there still. But they told me to wear these for both the swelling and to remind myself not to use my arm in risk-averse ways. But I gotta be honest, I don't think I would forget that my arm is messed up, because it hurts. It doesn't hurt, it's just super tight. So like I bend it up here and immediately I feel a bit of a stretch, but I can get it to here. And then when I extend, I don't really feel a stretch anymore, like a little bit at the full extension. But yeah, other than that, feeling good. The nerve is no longer in the cubital tunnel, which is awesome and also extremely weird. But again, that's the goal of this. And quite a bit of bruising that I'm sure will go down in the next 2 weeks. And then doing my right arm in less than a month, which I can't wait. Because my right arm, honestly, my right arm hurts more than my left arm, which is the arm I had surgery on. So if that makes any of you feel good about going into surgery, of course, find a good hand doctor who specializes in elbows as well. Find a hand doctor that does the whole arm if you can, but make sure they at least specialize in elbows, and ask them if they've done the surgery before, how many times they've done the surgery, what their personal success rate is, etc., etc. And definitely do occupational therapy. I've read a lot of doctors don't say you have to do occupational therapy. In my opinion, that's crazy. You should definitely do occupational therapy. But yeah, I don't use this arm for everything yet. I mainly just use it for the little things. It is my left arm, so I use it for less in general, but I've been using it like using a controller to control the TV, using my phone. I'll use it to text with. I don't really use it to pull anything or push anything yet, except in occupational therapy. It's still quite a bit weak, I can tell, but a lot of it's coming back. And yeah, that's basically it for today. Day 23, I believe I said, 3 weeks and 2 days post-op, and I'm excited to get through the next 2 weeks. I have my follow-up with my doctor on Tuesday the 28th, and then another week and a half of occupational therapy, and then at that appointment, we'll make an appointment for this arm, or the date for this arm, and then I'll be well on my way to being done with, hopefully, knock on wood, to being done with this whole subluxing ulnar nerve thing. Anyways, that's all for today. I'll post another video next week.